every man has a prostate. Is the function में has go prostate. Prostate जो आसान जन साथ पैटर्न. As we get older, the risk of prostate cancer increases as we get older. I was a young man, 1st July of 1999. I happened to do the first kidney transplant of my state.
इस वक्त हमारे साथ मौजूद हैं डॉक्टर तजम्मुल फाजली। डॉक्टर तजम्मुल फाजली पेशे से एक डॉक्टर हैं, जैसा कि हम जानते हैं, और उसके साथ साथ किडनी स्पेशलिस्ट हैं। अपनी ज़िंदगी के 22 साल यूनाइटेड स्टेट्स ऑफ अमेरिका में गुजार के अब वापस कश्मीर आए हैं। अब इनसे जानते हैं कि वापस कश्मीर आने का मकसद क्या था, यूरोलॉजी में क्या कुछ नई तब्दीलियां इन्होंने देखी है, क्या कुछ नई एडवांसमेंट इन्होंने वहाँ समझी है। तो इनके बारे में, इनके पेशे के बारे में ये तमाम तर बातें हम इस इंटरव्यू में आप तक पहुँचाएँगे। सबसे पहले थैंक यू सो मच डॉक्टर साहब।
Thank you so much for having me.
So we'll start आपके बारे में, because you have studied here in Kashmir, then you left, you went to Madras, then later to US.
I did.
So ये पूरी जर्नी कैसी रही, कैसा गुजरा है सफ़र?
Well, it's been a wonderful experience. That's how I'll put it as. I'm 61 years old now. मैं जैसे आपने बताया, I'm back to the valley after 22 long years. Madras, I was a young man in 2002. I was 36, 37 years old. And I had a wonderful time experiencing the outside world. I was in the UK for about 4.5, 5 years. And then I spent about 17 and a half years in the US. So all along, if I put it together, it's been a wonderful experience of learning, of imbibing, kind of experience of Western culture, and then coming back to my parent country, parent town. And I think it's a privilege. I find it as a privilege to be back on my home soil and sitting and talking with you guys with this wonderful TV channel and trying to pass it on to my community as to what I would be able to, what I would try to and persevere to offer to my people, having gained whatever experience I have over these years, assimilated it, and now try to dissipate it to my community.
Tajamul Sahab, one thing is very clear and evident when we talk about someone, yus yet pe needed pate अमेरिका छु गसान या इंग्लैंड छु गसान सो चुन वापस वहाँ सहल के
True.
क्योंकि देयर आर मेनी रीजंस। शायद वहाँ का लाइफस्टाइल बेहतर लगता होगा, या वो वहाँ इतने बिजी हो जाते हैं कि तिम चिन हकां पत वापस इत की। सो यू केम बैक। कितनी डिफरेंस है वहाँ के लाइफस्टाइल और यहाँ के लाइफस्टाइल में एज अ मेडिकल प्रैक्टिशनर? आप इसको किस तरीके से देखते हैं?
I think it's a great question. I don't think there's any perfect place on the face of this earth. Perfect place was only paradise, which Allah has promised us, and inshallah we hope you, I, all of us inshallah go to paradise in the afterworld. But for now, I think there is a lot to learn from the West. There's a lot to learn how you practice medicine and how you deal with people in everyday life, your patients, how you take care of your patients. इस पर दूध प्याल छु ना आसान, दूध प्याल पेवान पकनाउन सु ललवान थप कर तो बे अतन गस ग्राय ना गोस न वस पियोन. That's how we take care of patients in the West. And I'm happy to kind of tell you, it's been a pleasant surprise to me when I got back a year and a half ago. I think when I left, that was 2002, in these 22 years, I think this place, this city, this state has not changed, it has transformed in more ways than one. So what I mean to say is the youngsters, especially the youngsters, the physicians, I think they've been exposed to a whole lot than when I was at their age, at their stage. I think India and Kashmir has come a long way in getting, astride with the rest of the world. It has caught up in a lot of ways. So when I got back, I think we do see a lot of change. As I said, I feel proud to be a part of this community, especially the younger people who have trained in my department, and I have seen other departments as well, having worked in the private sector for a year and a half now. These people, these young men and women have gone out, they have been exposed, they have got trained, they have assimilated, and then they're back and in private practice in their own town and delivering, I think great, doing a great service to the people of Kashmir health-wise.
Why do you think कि लोग खास तौर पे doctors and engineers, but I'll talk about doctors, यहाँ से बाहर के मुल्कों में जाते हैं? For better opportunities, for better career, or is there something else?
I think there's a couple of things which I have learned over these years, because I've lived in the West, as I said, for 22 years. I think the fundamental thing is honesty. You learn to live an honest life in the West. There might be corruptions at the highest level in the West, but day-to-day life is very simple. Simple in the sense it's very straightforward and very pristine, without any, I should say, bunglings. I mean, simple things get done without you having to struggle for it. You need a driver's license. There's a set pattern. There's a set protocol. You need to go to med school. You need to be doing well in school. There is transparency, and I think you get a lot of opportunity, especially in the United States. Compared to the UK, I found the United States way more transparent and way more open to the rest of the world, and more opportunities to the rest of the world overseas compared to the UK.
We need to shift.
Yes.
So, डॉक्टर साहब, हम बात कर रहे थे कि क्या कुछ खास है, क्यों लोग यहाँ से वहाँ जाते हैं and all. So you explained it quite. लेकिन अब जब वापस आते हैं, क्या do we have enough opportunities here back in Kashmir, और ख़ास तौर पे उन लोगों के लिए जो अमेरिका से, यूके से या बड़े मुल्कों से, एडवांस मुल्कों से वापस आके कश्मीर में अपनी प्रैक्टिस करना चाहते हैं?
I think again it's a great question. Boss, I mean, मैं वापस आया because I think a lot of people might not agree with me on this, but I think I had a real reason, a genuine reason to come back, and that genuine reason is my aging parents. My mom and dad are really old. They're in their late 80s, and जब से मैं गया पहले, when I left, it was always pinching me at the back of my mind, what should I do when they get old? And when that day came, I had to take a very, very bold decision. And it was not an easy decision for me to take when I thought of winding up my practice in the US of 17 and a half years and come back to this place. But again, जो मैं आपसे पहले बता रहे थे, I think I was pleasantly surprised with the kind of facilities this place has developed over the last few years. More so, I mean, I have not been in the government sector. I have not worked when I got back. But I think the private sector has come a long way over these last decade or so. So we do have a lot of facilities available in these new hospitals. Again, it doesn't come quite near to what we have in the West, but at least we have made a beginning. This is the beginning of the journey towards establishing a world-class healthcare setup in India and in Kashmir especially. I think we're not quite yet there. There's a lot of work to be done, but at least we made a beginning. And I think we are on the path to deliver good, solid healthcare in this part of the world.
So you talked about your family कि ये एक बहुत बड़ा reason, and there are many people जो शायद इसी वजह से बाहर नहीं भी जा पाते होंगे और यहाँ इसी वजह से बाहर आते हैं. Tell us something about your family so that we'll get to know कि किस background से आते हैं.
Well, thank you so much for getting this into the limelight. I'm born to, my dad's name is Mr. Nazir Ahmad Fazli. He's a retired chief engineer public health. He did his engineering way back from Anandpur in Andhra Pradesh. That was in the early 50s. There was no engineering college here. And my mother is a retired gynecologist. I think she was possibly the fourth or the fifth girl from the state of J&K to go down all the way south to Madras Medical College in Madras because there was no med school in Srinagar. And she came back in 62. They got married in 63, and I'm born in 64. So that's my parents. And alhamdulillah, what I am today, I owe it to them. The way they brought me up and the values they inculcated in us. We're four siblings. I have a brother, younger brother, and two younger sisters. My sisters live in town. They're well settled, married, alhamdulillah. And my brother he lives in the US. He's an infectious disease consultant. He lives in West Virginia. And I have two sons. My wife is a retired, but she's not retired. She sacrificed her career. She's an anesthesiologist, but she sacrificed her career when we left. I have two young boys. My older son is a urologist. He works in Tampa, Florida. And my younger son lives in New York. He is an environmentalist, so solar energy,
So you
renewable
have
energy.
you have a family full of doctors.
We do,
full of
alhamdulillah,
doctors.
we do.
Okay. So अब इस प्रोफेशन के बारे में बात करते हैं डॉक्टर साहब, बिकॉज इट इज़ वेरी इंपॉर्टेंट, वारियाह ज़रूरी क्या इसके वन तुझ आमद अमेरिका पे एक्सपीरियंस है पानस से एंड जब हम किडनी से रिलेटेड इश्यूज देखते हैं तो कश्मीर में भी ऐसे लोग हैं जिन्हें किडनी प्रॉब्लम्स होती है। कुछ वक्त पहले तक हमारे पास डायलिसिस सेंटर्स भी नहीं थे इतने कि हम अपने पेशेंट्स को ट्रीट कर पाएँ। तो कश्मीर में जो प्रॉब्लम्स आप देखते हैं वो क्या क्या हैं ख़ास तौर पे, क्योंकि अब 1 साल यहाँ भी आपको हो गया है, और किडनी से रिलेटेड जो इश्यूज हैं उन्हें किस तरीके से उनके साथ किस तरीके से डील किया जा सकता है?
आई थिंक व्हाट वी हैव टू, जो मैं मैसेज देना चाह रहा हूँ अपने लोगों को, अपनी कम्युनिटी को, आई थिंक वी शुड keep a very close eye on our health. Which, again, that's another good thing which I have learned. People have become more health conscious here than what they were 22 years ago. I see a lot of people going on walks. Utan concept hai asan walk gastu ya physical activity, going to the gym, swimming, yoga, burn some calories. So I think basic things should live a healthy life, eat healthy, cut down on your carbohydrates and proteins, take a lot of fruit, vegetables, green leafy vegetables, and if there are any issues, and get yourself checked a couple of times a year, get your labs done, get your physical exams done. They call it a well man clinic or a well woman clinic. Get yourself assessed. Magar agar kehte asan, if you have any early symptoms, agar urinary symptom asan kya, just get yourself checked by a nephrologist or a urologist. Or if you have some issues, urine infections, people get older. That's the other thing. We are getting older and older, and it's an older population now. So the older we get, the more health issues we have. So health age has increased all over the world. Our life expectancy has increased. So the longer we live, obviously, the more problems we'll have as we get older. But that does not mean cash pach bomb pattern. There's nothing to worry about it. Agar get yourself checked, live a healthy life, do exercises, eat healthy, and you will live a healthy life. Allah Ta'ala richin agar any issues, just don't leave it under the carpet. Go and see a physician. They'll take care of you.
So, डॉक्टर साहब, अब यूरोलॉजी के बारे में आप कई सारी चीज़ें बता रहे थे, लेकिन यहाँ कुछ ऐसी चीज़ें भी है जो हमारे जहन में रहती है। अगर हम देखते हैं कि कोई शख्स 3 से 4 बार वॉशरूम फ्रीक्वेंटली जाता है तो हमें लगता है कि किडनी की कुछ प्रॉब्लम है, बामरान क्या इथा डायरेक्टली और इनडायरेक्टली कुन पर लिंक्ड आसान आसित?
Usually गसान problems younger age must hekan younger age group must, but urinary issues by and large they're way calmer than the older age people, both men and women. As we age, a lot of changes gasan body mus, especially hormonal changes body mus. Ladies and we see a lot of ladies in their middle age, in their 50s, in their 60s. They frequently gasan, as you said, 3 old gasan washroom. Because estrogen levels gasan body must come as we get older. Ladies get into menopause or perimenopause around the time the menstrual cycle ban gasan. Estrogen levels get lower and lower, so that can in turn lead to urinary frequencies, urgencies because of local changes in the urinary tract. So agar yimke symptoms asan, basically ladies and urinary tract infections very frequently. The reason being, there's a couple of reasons. In females, back passage, the front passage, they're right next to each other. Then the ladies have a very short urethra. It's 4, maximum 4-5 centimeter straight tube. And again, during sexual intercourse, the woman is always the recipient. So they are more liable to urine infections. So ladies and there is nothing to hide. There's a lot of taboo in the past. Again, that is getting better and better. I have seen a lot of younger women, they come out with all these issues and they are more upfront and more transparent about it, which is very encouraging because it helps us to diagnose disease early. So, ladies and mas issues asan, come and see a urologist. urinary infection it can be treated. Scans more frequently. Ultrasounds available way more frequently than before. Yeah, CT scans agar karan pen such stones or some, they can be caused. Whatever. The bottom line is, if you have any symptoms, do not hide them. Bring it up with your husband, with your family, with your mother. If it's a young girl who has issues, bring it up, and so that you can be treated. In us men, as we get older, the prostate starts getting a little bigger. Again, it's a sign of aging. There is nothing abnormal about a little enlarged prostate gland after 50, 55 years of age. It's ladies and menopause. I call it andropause, because again, our testosterone levels get a little lower. And it's like graying. We all gray. Is the boy is getting chatan. Or is there anything wrong with graying? No, it's natural. It's a sign of aging. Same thing with the prostate. It gets a little bigger. So what's there to worry about? If you have any symptoms, just get it checked and go and see a urologist.
इस पर तो prostate वनवो ये चे कशीर में जैस वारिया normally इस्तेमाल कराएं ये लफ्ज़, मगर deep down शायद सब लोगों को मालूम भी नहीं होगा कि actually होता क्या है. तो अगर आप इसे थोड़ा सा लेमैन के लिए, हमारे लिए जिसे मेडिकल टर्म समझ नहीं आती है, उनके लिए थोड़ा एक्सप्लेन करें व्हाट एक्चुअली इट इज़ और ये क्यों होता है और किस स्टेज पे हमें घबराने की ज़रूरत है और कब तक ये नॉर्मल है.
Every man has a prostate. Is the function में has go prostate. Prostate जो आसान ज़ंसात पैटर्न. It gets a little bigger as we get older. गसान चुन prostate चुन normal is a normal organ. To answer your question, why would there be, Allah Ta'ala ma बनाए हंग तो मंका चीज़. अच्छा, prostate जो basically कराना produces a lot of nutrients. Using sperm khatra आसान चु mandatory to keep a sperm viable, so that it can fertilize an ovum. It is important for reproduction. For sexual function, prostate important. It is important for reproduction, for the fertility of a man. Okay. Because it produces a lot of nutrients for the sperm. Sperm, it's a very frail cell of the body. It cannot be alive for too long. It has to be really fast. It has to be vigilant and really fast and go and fertilize an ovum. That's how reproduction occurs. That's how a man can fertilize a woman and become a father. So as we get older, the prostate goes on board. So Allah Ta'ala richin, atmosphere bamrin like cheese. Agar urinary symptoms can gatsan, which is again a normal part of aging. Achugasun urologists wushun test karna on tim kya. तो पता अगर तुम टेस्ट द्राय सारी ठीक दवा फुल पेवान कुछ साथ क्यों just to keep the prostate under check. युथी थोड़ा relax यू गए युथनी blockage करे urinary passages तम सित कसान चे urinary symptoms better frequency आसान चे urgency आसान चे या रात कुछ पेवान कुछ साथ वाथुन या अल्लाह ताला रचिन bleeding चे कुछ साथ कसान urinous मस ताता को इलाज करित वाइन अगर अल्लाह ताला रचिन it can turn cancerous as well. The prostate can, yes. Okay. As we get older, the risk of prostate cancer increases as we get older. We are taught, what I have learned in my medical profession as a urologist, agar in men and their 80s, which is one, I'm sorry, prostate cancer is agar Allah Ta'ala rashin govtikais. What I want to convey to my community, agar Allah Ta'ala, we are taught if a man has to get a cancer, he should get it from the prostate. Prostate cancers, 90% of the times, they are slow-growing cancers. And if we find a cancer in an older man, in an 80-year-old, I don't think there's a lot to worry about, because it's a very slow-growing, we can even keep an eye on it without doing any active treatment. That's one any active surveillance. That's PSA shows some blood test, prostate-specific antigen. So it's recommended that men after 55 years of age, up to the age of 70 or maximum 75, get their PSAs checked. We very karok PSA check. Agar Allah Ta'ala rishin PSA was high, kun saach pewan prostate biopsy karan ya MRI pewan karan prostate as khadr. Ye wishne khadr ye mach under mach abnormal mach prostate as. But the point I'm trying to convey is, get yourself checked. Agar PSA high was bomnun chun ke PSA high asun chun, it does not always mean cancer. That hekan chesh karit has tests waria biopsies pewan kun saat karin. Agar Allah Ta'ala rishin prostate cancer, go to diagnose. I don't think it's a life sentence like brain cancer, God forbid, lung cancer, stomach cancer. Those are aggressive cancers. Prostate cancer is indolent cancer. It's a slow, very slow growing cancer. And I want to tell my people it can be cured, not just treated if we catch it early. Tamichu, it's best to get yourself checked. Blood tests karnaun, scans karnaun ki agar Allah Ta'ala rashin kas prostate cancer they will catch it early, and 9 times out of 10 it can be cured, not just treated. Prostate cancers are curable if we catch them early at an early stage.
Okay, so ये is possible. इसके बाद इम्पॉर्टेंट चीज़ बनती है, क्योंकि आप यूरोलॉजिस्ट हैं, जैसे आपने ही कहा कि यूरोलॉजिस्ट यूज वुचान द सर्जरी पार्ट ऑफ द किडनी, एंड अब किडनी ट्रांसप्लांट काफ़ी फ्रीक्वेंट हो गया है. पहले शायद इतना ज़्यादा नहीं था. अब कश्मीर में भी होता है, किडनी ट्रांसप्लांट किए जाते हैं और एक किडनी पे लोग सर्वाइव करते हैं और अच्छे से जीते हैं. किस चीज़ में यूजुअली किडनी ट्रांसप्लांट होता है? इज़ इट कि जब ट्यूमर हो जाए, क्योंकि हम जब यहाँ देखते हैं तो ट्यूमर आज के टाइम पे इतना एडवांस हो गया कि अब सिर्फ उतना पोर्शन उस किडनी में से रिमूव किया जाता है और बाकी किडनी को भी बचाया जाता है. तो किस तरीके से वो पूरा प्रोसेस होता है ट्रांसप्लांटेशन?
Which was, well, I might, for the sake of my audience, I might say I was a young man. 1st July of 1999, I happened to do the first kidney transplant of my state. That was in Sherry Kashmir Institute, 1st July 1999. I was 33, 34 years old at that time. So alhamdulillah, then we managed to do some more.
जम्मू कश्मीर में पहली किडनी ट्रांसप्लांट सर्जरी आपने की?
That's correct.
Okay.
That's correct.
Okay.
That's correct. Alhamdulillah, I was privileged to be, and the first, that was, we call that a live related transplant. What we did here, there's something called a cadaveric transplant. Cadaveric transplant somebody who has died, God forbid, in an accident, and he's brain dead, timchasa ventilator spit, but the kidneys are still functioning. So we can harvest those kidneys and give it to people. The manzorat has that's one a cadaver transplant. I was a part of the first cadaver transplant of India during my training in Madras. When I was in Madras, Apollo Hospital, Madras, that was way back in 1996. I happened to be a part of the team who did the first cadaveric transplant of India. That was in Apollo Madras.
टीम का हिस्सा रहे, फिर कश्मीर का पहली किडनी ट्रांसप्लांट भी आपने की. तो आपने पूरे करियर में कितने किए हैं आपने?
Well, when I went to the US in 2002, US was thoda different has because the transplant department is separate.
Achha.
So I did about 20 odd transplants before I left here. But then in the US, I did not do as many kidney transplant. I did a lot of more cancer surgery, oncology, uro-oncology. That's what I trained in specifically in the US, and that's what I did more when I was gone out. To answer your question, transplant chikaranas, Allah Ta'ala is kidney. Kidney functioning unit is nephron. It's put cell chassis bodies, the kidney cell chassis nephron. We have about anywhere between 2 to 3 million nephrons. Good. वही लच पैटर्न 3 लाख नेफ्रॉन आसान दोन किडनियन मस मगर यम नेफ्रॉन छन दोश आसान all of these nephrons are not active at any given point in time. There's something called a nephron reserve. It's आसान nephron कश पर तिम आसान शेगित तिमन छन पेमान जरूरत तिहंज everyday life मज अच्छा तमी हकान छु किडनी कस अगर कस डोनर डोनेट करान किडनी, somebody gives his own kidney or her kidney to a dear one, humis roza akki kidney, dusi divan chu kidney. So kidney pat karan it starts picking up. Tim nephrons motan kashir per shengit cha asan tim shu hushar gasan, they start getting say active. The patient lives, the donor lives a normal life. To use recipient asan chu yimanis divan chi kidney lagan chi temis asan kidney doshvay fail gums. Agar a kidney kadav tikans Allah toy botan cancer asan Allah Ta'ala rishin kais temis peman a kidney kadai. He or she can have a normal life, pretty close to normal on one kidney, because tami kidney nephrons de gasan chu hushar kashir put, and they take over the function of the other kidney. So doshvay kidney Allah Ta'ala rishin kais damage gasan ya kadni chi peman kun sath ya accident go khuda ne at kais, which is not very common. But we have to replace giving them a kidney so they can live a normal life.
जिस किडनी से आसान जो भी शख्स एक किडनी पे जिंदा रहता है उन्हें किन चीज़ों का ख्याल रखना पड़ता है, क्योंकि अब अल्लाह ताला की तरफ से 2 हैं, इसका मतलब 2 ज़रूरी है. अब हम एक पे सर्वाइव तो कर रहे हैं बट डिफ़िकल्टीज तो आती होंगी, तो वहाँ किन चीज़ों का ख्याल रखना?
Again, a great question, which you not many, I would say quite a few times nafar iwan chukan like 5 war 3 war 5 war temis karan ches بیٚیہِ کُنہِ خٲطرٕ سکین الٹراساوُنٛڈ اَتہِ نَنان ہے أمِس اَکٕے کِڈنی توٚتانۍ چھِ آسان 20 ؤری گٔمٕتۍ 15 ؤری گٔمٕتۍ اینڈ دین they get to know or 18 years 20 years later they find this man or woman has only one kidney. But once we know there's only one kidney, I think one has to be a little bit more careful. اکھ چھُ کَرُن یِتھ پٲٹھۍ اوٚتام مےٚ عرض کوٚر حظ اکھ چھُ ڈایٹری کَرُن one has to be very careful with their diet. کاربوہایڈریٹ گژھِ ویسے تہِ کَرُن کَم فیٹٕس پَزَن اَسہِ کَرٕنۍ unsaturated fats یِم آسان فیٹ اِنٹیک کَرُن کَم lot of water, lot of fluids, lot of fruit, and lot of green vegetables, exercise. So we stay healthy, keep our weight under control. تَمہِ سۭتۍ روزان چھِ kidney function تہِ ٹھیٖک. So اگر کٲنٛسہِ اَکٕے kidney آسہِ after donating a kidney, or somebody is born with one kidney, and then we get to know he's got one kidney, just these broad outlines for healthy living would take care of that. Nothing really, when I choose a dawa khyun to pat gesi ati roji kidney theek, just our routine day-to-day life activities have to be modified in minor ways, and then one would have a normal life.
Ak cheez chu main be ak sawal kya iske before we wind up, usually Kashmir mein jab bhi koi bhi cheez hoti hai ische akhir kis vanan ki kehshun parvai tresh is chawan تریش ٲسۍ چٮ۪وان یہِ چھِ اکھ نارمل کتھ آسان یہِ چھِ اکھ أکِس وَنان نارملی لیکن یہ چھا یِتھ پٲٹھۍ تہِ اگر وٕچھو کہ ایکسس اگر ہم پانی پیئیں گے وہ ہماری کڈنی کے لیے ہارمفل بھی ہو سکتا ہے Is it like this?
Well, I think it's a good habit to drink plenty of water because we should, the human body about 75% is water. Cells yim چھِ سانہِ 75% 80% is water. We are made of water. Allah Ta'ala چھِ أسۍ بنیومُت یِہوٚے. So it's a good habit to drink, I would say on an average 2.5 to 3 liters of water every day.
Not more than that.
One doesn't need more than that. So if we are, I would not say that it would damage the kidney, but if you take more than that, you will have to be in the washing room a lot of the time during the day. Magar Allah Ta'ala rachina agar one kansi kidney failure aase, the kidneys are not able to excrete water. Timan ch patient in pewan chronic kidney disease, we might have to cut down water intake because the kidney is not able to handle that amount of water. Tam se hekan pat edema geshit, worm hekan chu geshit agar is zyada chemo hute asne kidney kaam karan ki. But if you have normal kidneys at 2.5 to 3 liters during summertime, especially in laborer asan chim they lose a lot through the sweat. Timan pewan chu you have to replace that. Agar garam aase variya tapas maz asu nebur kani liter gasan tachwana insensible loss. Without even knowing that you have lost 2 liters of fluid, you will just during sweat. So that time people. So again, if somebody is sedentary, andra air conditioning chair, aram sanjbit, he does not need to drink as much. 0.5 liter is good enough. And winters we are mostly indoors, especially in Kashmir. Insensible laws. So 2 liters should be good enough for most people sedentary. People who work out in the sun, summertime,
so they need more.
They need more.
So जो लोग डायलिसिस करवाते हैं क्योंकि डायलिसिस एक स्टेज पे करवाने की ज़रूरत पड़ जाती है तो उनके लिए क्या एडवाइस रहती है यूजुअली कमन चीज़ों ख्याल पे इस्तेमाल था Are they prone to infections?
Yes, which dialysis is going to Allah Ta'ala rachina when it comes to a point when somebody needs dialysis, that means his or her kidneys have come to a point where they are no longer able to perform their day-to-day function. We have to artificially help them getting their blood cleared of all the metabolites in the body. So we have to, the kidney, instead of the kidney being able to clean them up, we have to use a dialysis machine. So tuman rosen careful, yes, for a lot of things. I mean, they have to be careful about their intake, their output, urine output, quota ashek dose. Again, as I mentioned earlier, if they take more than what the kidney can handle, timan gets edema, timan hig waram khashit. Agar Allah Ta'ala shin waram khash, that'll have an effect on the heart. The heart will not be able to pump it out. So it'll be a vicious cycle. Every system in the body the lungs can get affected because the lungs are not, agar lungs are waterlogged, they'll not be able to breathe as well. So one has to be very careful when it comes to end-stage renal disease, dialysis khatran, timan pewan rozen careful, more so with they have to be really careful about their intake, kota chamo, to kota urine karo pass, to kota dialysis mas kota fluid pewan drain karun par dialysis machine se.
Okay. So before we wind up, Dr. Saab, one piece of advice for आर पीपल आउट देयर, खास तौर पे उन लोगों के लिए जिन्हें किसी न किसी किस्म से किडनी की परेशानी रहती है, क्या आप इस कारण या ओवरऑल इन जनरल क्या हम लोगों को करने की ज़रूरत है ताकि हम किडनी की इस परेशानी से अपने आप को बचा सकें?
I think again, as I mentioned earlier, I'll wind up on this basic truth. I think we should try to live a healthy lifestyle. We should eat healthy. We should exercise regularly. Fruit paz es khun diabetic im asan chh tim hekan variya zyada sugar containing fruit, but even diabetics can eat fruit. Fresh vegetables pazan es khen. As paz regularly exercise karan. As paz as a routine, as a matter of fact, paz es cut down karun carbohydrate, means take less rice, salt, sugar, ई पज करन कम अस कोल्ड ड्रिंक्स चेवान वारिया कशर मज बुछ we take a lot of cold, अगर अस अख कैन चेमो कोक, that's 300 calories without knowing you have just ingested in a minute you have ingested 300 calories. So मे बासान diet, exercise, healthy, stay as healthy as possible, and your kidneys will live longer that way. The better we eat, the better we exercise, careful rozum, live healthy, and that's my advice to my community.
चले, थैंक यू सो मच डॉक्टर साहब, इट वाज रियली नाइस टॉकिंग टू यू.
Thank you so much for being here.
थैंक यू सो मच. सो दिस वाज डॉक्टर तजम्मुल फाजली. किस तरीके से उन्होंने बताया, एंड अगेन एवरी डॉक्टर गिव्स अस दिस पीस ऑफ एडवाइस कि हमें अच्छा खाने की ज़रूरत है, एक्सरसाइज करने की ज़रूरत है और अच्छे लाइफस्टाइल की ज़रूरत है. और आज के इस मॉडर्न दौर में, फास्ट मूविंग वर्ल्ड में, अगर हमारा लाइफस्टाइल बेहतर होता है तो जाके हम एक बेहतर ज़िंदगी ज़रूर गुजार सकते हैं. अभी के लिए इतना ही. बाकी तमाम मज़ीद मालूमात के लिए बने रहें कश्मीर लाइफ के साथ.